Hi, my name is Madison and I'm a registered nurse at PRISM Aesthetics. Today I'm going to talk to you all about lip filler, everything you need to know before you come into your appointment, what to expect, and what to expect for aftercare once we finish. Whether it's your first time getting your lips done or if you've done it before, coming in for lip filler can be everything from exciting to nerve-wracking and anything in between. Swelling and bruising are always to be expected with lip filler. This can vary from person to person, but there are some things that can minimize your swelling and bruising as you're healing. Avoiding alcohol for at least 24 hours before your appointment is extremely important, as well as avoiding NSAIDs like aspirin or Aleve, ibuprofen for a few days before can help minimize those bruising and swelling effects. If you are prescribed any blood thinning medications, make sure you speak to your prescribing physician before stopping these medications. Before we begin your lip filler appointment, we'll spend 10 to 15 minutes consulting on your goals, different types of fillers that are available, what might look best in your lips, and covering any questions you can think of. You'll be visited with by one of our nurse practitioners who will make sure you're a good candidate for injectables and screen you for any contraindications to lip filler. During this time, it's important to mention if you have any history of cold sores, as lip filler can trigger an outbreak. Our nurse practitioner will make sure that all of your questions have been answered if we haven't already covered them in the consultation. There are lots of different fillers available that can be used in your lips that range from very flexible and natural to more firm and building. All of the fillers that we use in the lips are based with hyaluronic acid, which is naturally occurring in the human body. Because of this, our bodies metabolize this filler anywhere from 6 months to a year down the road. This can depend on your metabolism, whether you have filler already, how often you exercise, and many other factors. During the consultation portion of your appointment, we'll discuss whether or not you have previously had any lip filler. If you have, we may want to use the appointment time to dissolve areas of old filler using Hylenex. Using Hylenex to dissolve old filler can not only create a great fresh start and a good canvas to work off of, but long-term, your lips will maintain their shape and volume much better and look much more natural for you. We use a very strong numbing cream on all of our filler patients to keep you as comfortable as possible. We'll let you thoroughly numb so that your lips are as desensitized as possible to any discomfort you may feel. Because we use a very precise method of injection, focusing on shape and detail, you will experience many pokes during your appointment. However, they'll be relatively comfortable because of how strong that numbing cream is. If you're really feeling anxious about that pain, another option to consider is a lidocaine nerve block. We do have to poke you to get that nerve block going. However, we only poke the face in 4 spots, and then your sensations are completely deadened for several hours. This can be great if you know that you're anxious and that feeling even the slightest poke throughout your appointment is going to trigger that anxious feeling. Because we take our time during our appointments and we focus so much on detail, you'll notice that your lips start swelling as soon as you look in the mirror. It's not uncommon to feel overwhelmed when you first see your new lips, but just trust the process and know that they will come down and look more like themselves in the coming weeks. Bruising can vary from very mild to more severe, depending on how your lips do during your appointment. Aftercare can be very important in expediting your healing process. Lumps and bumps in your lips are definitely to be expected after filler, but after several weeks, your lips will soften out and feel exactly as they were before you filled them. After your appointment, ice can be extremely helpful to bring down some swelling. If you have any tenderness, Tylenol is great to take because it won't worsen your bruising. Avoiding medications like aspirin, ibuprofen, or Aleve for 5 to 7 days after your appointment can also help to expedite the healing process of those bruises. While swelling and bruising are almost always expected after lip filler, we make sure to discuss an important complication that can arise during your appointment before we get started. Vascular occlusion is an extremely rare complication that can come about anytime we're injecting filler in the face. As we're injecting your filler, we make sure to assess to make sure that your tissues are getting good blood flow and that there's no filler blocking that blood flow to the area that we're treating. If a vascular occlusion is suspected during your lip filler appointment, we follow our vascular occlusion protocol to make sure that it's resolved before you go home. In most cases, the filler will be dissolved so that blood flow is restored. After a few days, you can come back and refill your lips. When we finish your lip filler appointment, we set a 2-week follow-up with you so that we can check in and make sure everything is healing right on track. Any lumps and bumps that you still feel in your lips at the 2-week mark will be massaged, and we'll teach you how to massage your lips so that you can begin massaging them at home until they settle out fully over the coming weeks. Avoiding NSAIDs like ibuprofen or Aleve for 5 to 7 days after your appointment can also help prevent bruising from worsening. Over-the-counter arnica, an herbal supplement, may be taken to speed up that healing process. You can also ice your lips or take Tylenol if you feel any discomfort after your appointment. If you're worried about swelling, you can even take a Benadryl the night after your appointment before you go to sleep to help keep some of that swelling down. While your lips are healing, you are always more than welcome to reach out to either of our office numbers if you have any questions or concerns that come up. We love to help you feel at ease during the healing process, as it can be overwhelming waiting for your lips to stop swelling, to stop bruising, and to look like themselves again. One thing that we always tell our patients after lip filler is to avoid any kind of repetitive motion to the lips that can alter how that filler settles. This could be things like straws or vapes if you're a smoker. We recommend that our patients avoid straws for a full 2 weeks, and if you are a smoker, make sure to only use the sides or the corners of your mouth rather than straight in the middle. Avoiding these things can help that filler to settle out more smoothly and faster. We'll also want you to avoid putting makeup on the lips for at least 24 hours, preferably 48. Once you begin wearing makeup after your appointment, make sure that any applicators or products that you're using on your lips are clean and have been sanitized. It's also important to make sure that your hands have been freshly washed before touching the treated area. Many people will experience dry lips during the healing process, so you can use things like Aquaphor to keep them hydrated and more comfortable. We tell most of our patients to keep in mind that if they get a full syringe of filler, at about the 6-month mark, they'll be ready for a little bit of filler for some maintenance to keep those lips looking plump. We're so excited that you've chosen to come to us for your lip filler. If there's any questions that you have that haven't been answered in this video, we'll be happy to get them answered before we get started. We want you to feel as comfortable and confident as possible in this treatment, and we're so excited to meet you.